Good day, everybody. It's DocTalk, another week. We are in the springtime. Lots of storms occurring across the country. Be careful, all of you in the middle to eastern part of the country. I happen to be in a conference for the second week in a row. It is clearly a different time when we're back on the on conferences, meeting, talking to each other. Getting great ideas about what has happened over the last 2 years and what we're going to need to do moving forward to serve our communities better. It's thrilling to see people again and to be able to interact with the people that you haven't seen other than in a little box on the computer for a couple of years. So rather than Doc Talk this week is about you talk. I get both emailed, requests for information, talk to a lot of the people that I work with in the departments that I'm with. And here I am at a conference with people asking me questions based on what we get to talk about every week. So a couple of big questions that came from you all this week that we can talk about. First, there's this discussion about the new variant, which officially is called BA2. It's a form of Omicron. In other countries, particularly in Europe, it has caused a little bounce back in cases, nothing dramatic, nothing like BA1. And so far, those countries have not had problems managing the patient loads in terms of those being sick enough to get into the hospital system. So we have in some areas of the country a slowing of the downslope, and in some cases even a minor upturn in the number of cases, and I'll just say a stabilization of the number of hospitalized patients, but at a very low level. So if you look at any of the graphs in this country, we're down to about the level we were last summer in number of cases, number of hospitalizations, and number of deaths, and it's so much better than we were in December and January. But BA2 is a variant that is being watched now by all the public health officials to make sure that we don't have an increase in the number of cases, the number of bad cases, and the number of deaths. That results in us doing a lot more checking about people and where illnesses may be occurring and why, and whether they're occurring amongst vaccinated people or not. So let's get to the number one question of the week, which is, what about vaccinations, Doc? Are we going to benefit from getting vaccination now if we haven't been vaccinated? What's going to happen with boosters? So for those of you who have not been vaccinated, there is still very good reasons for you to go get vaccinated, even if you've had the illness. We know that the best form of immunity at this point to coronavirus is for you to have had both the illness and the vaccination. Not that anyone would try to go get the illness, but those that have had that misfortune, if you have had it, you have built some immunity. You get additional significant protection if you get the vaccination on top of it. The vaccinations, we're still waiting for the Novartis vaccine to be approved. That should come in the next few weeks. So a different type of vaccination you will hear about. It is also a two jab vaccination. The vaccination then world is Moderna, Pfizer, Johnson & Johnson. Amongst those three, we have great protection. More than 11 billion shots have been given across the planet. 11 billion shots with very good experience that they are safe. The new vaccinations series, they're going to break out the time between the first and the second. So if you're going to get your original series now, they'll break it out to about 2 months between the first two. And then in many cases, if you haven't been sick, they will ask you to go and get a third jab for the RNA vaccines. All of them build immunity and protection for you no matter what variants come out amongst coronavirus. So for those of you who thought about vaccinations or had an idea about 1 or 2 or 3, that's where we are for fully immune people. It is very good idea for those people who have not good immune systems, who don't have good immune systems, to be thinking about a fourth jab. And that's where we are in the science right now. For those that have had the first three, but have a compromised immune system because of some other disease, it is likely before the fall that they will want to go and get their fourth jab. It may be done in conjunction with the flu vaccine for the fall. So that's what you might be thinking about. For healthy people who have had three events, you've heard us talk about that, three events. So either two vaccines and an illness, or an illness and two vaccines. If you've had a J&J, that counts for two, and an RNA on top of that, that's three events. You get to that. It is not at this point known to be beneficial for you to get that fourth jab. So hold off on information related to that. It is likely that the Novartis vaccine will be approved, and so that will be an additional piece of tools in our armamentarium. The other big news of the week is that children under the age of 5 may likely be eligible, and it is possible, as of the information released 2 days ago, that Moderna will be the first of the vaccines approved under age 5. That will go down to about 6 months of age. And at that point, they will likely add the coronavirus vaccine to their childhood immunization jabs that they get, that are very important for the child's immune system building out. So that's a little bit about the vaccines that you were asking about. Number 2, what about masks? Throw them away or keep them? Keep them. Plan on using them this fall. The reason is we have really knocked the stilts out of flu and other infectious illnesses that spread by way of secretions by the use of our masks. I think most departments will keep the masks in their toolbox for the summer. For anybody with infectious illnesses that we take care of over the coming months, you will still be asked to use an N95 in the patient encounter if you're within 6 feet of that individual. You will continue to use a plain mask on the patient who may have respiratory infectious symptoms. So that probably won't change. When it comes to this fall, we hope not to be dealing with a big coronavirus outbreak again, okay? Even if we don't, many of you, like me, really liked not being sick with respiratory bugs and flu. And so when it comes to encounters, either with patients or out in the public in places with poor ventilation, we will likely pull our masks back out and apply them again so that we have protection from respiratory viruses like the flu, like strep and other things. It is very well proven now that masks reduce the respiratory spread of diseases, and that will be a very wise idea come the fall. Come the fall, we will be told again, do not come to work if you're sick. Don't be sneezing and coughing in the stations, in the vehicles, around other people. That's not comfortable anymore. So our norm of going to work sick will likely change. If we get everybody to contribute to that, then we reduce the illnesses overall in our stations, in our workforce, and we all stay a little bit healthier. Children at this point are still spreading a lot of respiratory bugs, and just so you know, they do that because they build their immune systems by being exposed to lots of things when they're little, and their young immune systems can build a lifetime of protection. So in the school systems, we are seeing lots and lots of respiratory spread diseases as the masks come off the kids and they begin to congregate again. That is expected. It's probably beneficial long-term to people. The children with weak immune systems still have to be a little more better protected. And for them, they may still want to be in masks, do more social distancing. And if COVID is moving through the system, their parents may want to do something until they're vaccinated and capable of protecting themselves. And finally, into the fall months, we are going to have GI illnesses and other things that spread. They're spreading already, and within my family, the throwing up, diarrhea, cruise ship virus, no fun, not any fun at any point. In the fall, we're likely to see the spread of those kind of diseases too. There it is keeping your hands clean and keeping your hands away from your face and mouth that are really protective. So this is a U-Talk week. And I will continue that theme next week. If there's questions that you're pondering and need an answer to as we move into spring season, love to hear them. Send me a note or talk to me if you see me at one of the conferences that are upcoming. Great that we have an opportunity to interact with each other again. It's really nice to be back traveling and seeing people. That's what we love to do in our field. You know, we are extroverts in general in this field. We love being around other people, interacting with them, hearing their stories, what's happened to you over the last 2 years. So there we are. So DocTalk,